Good morning, my name is Jessica Neal, and today I'm going to be talking about how CoolSculpting actually works. We've gone over a little bit of side effects and things like that before, but this is about how it works. So I'm not going to make you wait for the answer. I'm going to tell you right away. Maybe? Oh, okay. Darn. All right. Good morning. My name is Jessica Neal, and this morning I'm going to be talking about CoolSculpting and how it actually works. So I'm not going to make you wait for the answer. It's cryolipolysis. That's how CoolSculpting works. And what happens is cryolipolysis is when you can selectively affect and eliminate fat cells without damaging the skin or the surrounding tissue. So we can put an applicator on someone and only affect the fat cells. So here's a little overview of the whole process. So everyone has a little bit of stubborn fat. So what happens is the CoolSculpting technology uses controlled cooling. So it only freezes at a certain temperature that will not affect the surrounding tissue, which is cryolipolysis. Target and kills only these fat cells. No damage to nerves or other tissues because the lipids in the fat crystallize at a warmer temperature than water in the other cell types. So that's how we can not freeze or damage the skin on the outside. So in the weeks and months following treatment, the remaining fat cells, they will enter a natural cell death, which is apoptosis, and then they're gradually removed by the immune system naturally. Then over time, over a period of 2 months, fat layer is significantly reduced, and the little bulges that the person in number 1 had before are reduced in after. So this is a little bit about accumulation of fat. So once you hit about puberty, you're going to have a set number of fat cells. Now, as you gain weight, these fat cells increase in size, not number. They increase in size. So same thing goes when you lose weight. The fat cells decrease in size. So instead of, the fat cells going away, they're just getting smaller or larger. So where does the fat go when you do CoolSculpting? Well, here's a little picture before. The fat is evenly distributed. You can tell in their abdomen they have a lot more fat than in the other areas. So after CoolSculpting, when we get rid of those fat cells naturally, we lessen the opportunity to store the fat in the treatment area. There is a reduction of about 20 to 25% per treatment. And then as you can see everywhere else, it's still evenly distributed. Just because we got rid of fat here doesn't mean that all of a sudden you're going to have more fat here. It just means that you're going to continue to evenly distribute it. So who's a good candidate? People with noticeable bulges and stubborn fat that are resistant to exercise. They have people telling me all the time that they're at the gym every day and then they just have this stubborn area that won't go away. It has to be pinchable and subcutaneous. We can't treat visceral, hard fat with CoolSculpting. People who are interested in non-invasive treatment. This is not a substitute for liposuction. Liposuction is the best for getting rid of fat, but this is a good option for non-invasive results. So people should maintain a normal diet. Just because we got rid of 20 to 25% of your fat doesn't mean that you can just continue eating the way you were before. And CoolSculpting is not a weight loss solution or a substitute for surgical methods. So what can you expect during treatment? It's once we put the applicator on, it's pulling, it's tugging for about 5 minutes. After the cooling has been started, you start to feel those side effects subside. You still will feel kind of a cold and tingling, but then you will start to get numb and you won't feel that as much. Immediately after a treatment, when we take the applicator off, it's been suctioned on for an hour, it's been freezing for an hour, so the skin looks like the shape of the applicator. There's a 2-minute massage involved that decreases that appearance. Patients will still be swollen, but they won't have that butter stick appearance. So the first few days and weeks after a treatment, there's definitely swelling. Some people bruise. We can never really know until we take that applicator off if they're going to bruise or not. But there will be swelling. I always tell people you're going to feel larger when you leave than when you came in. But that lasts about a week, and then the swelling subsides. Some redness, tenderness, it almost feels like bruising. And the bruising actually is more of like a petechiae bruising. It's more of like a hickey type bruising than an actual, you got slugged type bruising. So these side effects can be helped. Definitely, I recommend compression garments, especially when we're doing the abdomen area. It does help with relief of not only the tenderness, but also the swelling. It makes you not feel so large. Icing, heating pads, or stretching. And then changes can be seen as early as 3 weeks, but mostly between 1 to 2 months. At 2 months, you'll see 70% of your results, and at 4 is 100. So here's just some photos for you. So now we have 2 sizes, the large and then the regular size. The large is more for debulking, so that's what this person did on their lower abdomen.
Could you go back? I just want to point out what the right says at the bottom. It says no weight change.
Right.
It's really important.
Yeah.
Places won't actually use before and after pictures go weight. It's so easy to alter. And so the pictures may be after they dieted, they might have done steroids even.
Exactly.
With this, there's no weight change.
Yeah, and that's a good point because I tell people, they always ask me, oh, well, will I lose weight if I'm losing fat cells? Well, no, you're not going to lose weight, but this is more about inches. And yes, you will lose weight if you diet and exercise, but not just from the procedure itself. And another thing to point out here is this is 2 treatments, not just 1. That was 2 treatments. And then so here, you can see that their back fat is reduced. And they did lose 3 pounds, but that's not that much. This is more sculpting. This person had some excess fat, and you can see in the second treatment, they altered the treatment plan a little bit to sculpt more of where they were at that time. And there, she already had a flat stomach, but she had some weird pockets of fat that were eliminated. And that was only 1 treatment. Another one. Now this is where we needed to get rid of, well not we, but they needed to get rid of some extra fat before they sculpted the body. So they got rid of some upper and lower and then did some sides. Same thing here. And then it's also helpful for asymmetry. I've seen people with asymmetry here and we've helped correct that. And then this you can just kind of see. So that's the result you would get with 1 treatment. Some people are happy enough with that, but we always recommend 2 treatments to get this result instead of the middle result. And now we are treating thighs, outer and inner thighs. This is just an example of the outer thigh. And that we use the Cool Smooth. And here's inner thighs. She has a bigger gap. And another one. And a quiz.